So our project is a 2-year initiative funded by the Public Health Agency of Canada with the aim to promote the engagement of people living with dementia and their family and friend caregivers in advanced care planning through community-led interventions or initiatives. We recognize that for people living with dementia, the loss of decision-making capability is a bit more certain in the advanced stages of dementia, especially. So this means that people living with dementia have a window of opportunity to really get started on advanced care planning as soon as possible and to maximize their advanced care planning options. The community piece, the community-led piece. And how this works is that we actually partner with community-based organizations, and in our case, it's organizations in British Columbia, to provide them with the tools, knowledge, skills, and confidence to deliver advanced care planning programs in their own communities. It can help bridge the gap that is currently in kind of advanced care planning knowledge, especially when healthcare providers may not always have the time to share this information with their patients. These community organizations, they know the people in their communities the best, and they can really tailor these programs to the needs and capacity of their own communities. Many people think it's really just for those who are seriously ill or injured, and that is really not the case. Advanced care planning is for every adult. Ideally, you should be doing so before you actually become ill. So the best time really is to start as soon as possible, and ideally when you are still healthy and capable of decision making. Many people think that it's just about end of life, and that is really just not true. And I think framing advanced care planning as about an end of life can stigmatize the topic because in many cultures and many individuals may be uncomfortable with talking about end of life care and end of life issues. Because of the interest from our community partners and without whom this would not be possible, we were able to overall train 28 community organizations and over 84 staff and volunteers from these organizations to become advanced care planning facilitators and to continue to deliver these programs and sustain these programs even after the project's completion. And the organizations were very diverse. Like I mentioned, they really were from both urban areas and also rural and remote communities, and they supported a diverse population of British Columbians. I'm very proud of our public engagement efforts. We really made a conscious effort to partner with end users or people with lived experience, so older adults, people living with dementia, and family caregivers throughout this entire journey. And they were engaged in all phases of the project through all possible avenues for public engagement. So not just as focus group participants, but also as decision makers sitting on our advisory committee and expert task group. Our efforts was actually recognized by BC Patient Safety and Quality Councils in their Patient Voices Network's annual report as a public engagement effort in action and highlighting the quality of our public engagement efforts. So it was a really proud moment for the team. We have incorporated the 2 advanced care planning programs that we've developed into the existing community-led model at BC Centre for Palliative Care, and the center is committed to continue supporting organizations with delivering these programs by offering annual training sessions to a new cohort of community organizations, staff, and volunteers. So I think by building the programs into the offerings and services we already provide at the BC Centre, that will really help to maintain sustainment. And of course, by partnering with the community organizations, they're the ones on the ground and delivering these programs. So that takes kind of the weight of that off of our shoulders at the center, and we are infinitely grateful for their collaboration, their partnership. I think it's important to really focus on conversations rather than forms, on storytelling as well, and using stories as examples to engage people. We found that that was really effective. And also, of course, to focus on quality of living and quality of life rather than, for example, the prognosis of dementia or also end of life, which are both highly stigmatized kind of topics. The other piece of advice I think would be really to involve, the end users, so whoever you're delivering these programs to or in collaboration with, as much as possible. We really could not have done this without our community partners who sat on the advisory committee, our public participants who sat on the advisory committee expert task group as well. It only makes sense for us to involve people who would be impacted by these programs in designing these programs.